Good morning. We'll go ahead and it's 10:30. I'll just catch the stragglers that come in. I'd like to introduce Katherin Rybak. She is an attorney at Indiana Legal Services here in Evansville. She's been there for 35 years. This session is Introduction to Advanced Directives, Basics of Self-Determination. And I know from experience that Katherin has a lot of good knowledge because she's done a lot of training with us at SWRCA. So thank you and welcome.
Well, thank you for having me.
You're welcome.
I'm a little bit rusty on this presentation, but I'll do the best that I can. Indiana Legal Services provides free legal help to people who have low income or people over the age of 60 without regard for income and assets. And probably the main thing that we do for people over the age of 60 is advanced directives. It's on our priority list, it's way up here, because having an advanced directive is what I view as client prevention. If you do a good advanced directives when you're able, then you won't need a lawyer later when you become incapacitated. Everything will be in place to handle both the finances and the medical decisions that might need to be made. So that's the big why of doing it, and it's something that you can get free help with, or if you have an attorney who does your estate planning for you, I'm sure that will be mentioned to you as part of a package of planning for both end-of-life decisions and, of course, the distribution of assets after death. The first thing I'm going to talk about are healthcare decisions, and that's been our primary focus because even though we are able to help people over the age of 60 who have assets and income, certainly the emphasis is usually on people who don't have a lot to worry about in terms of an estate. So anyway, with regard to healthcare decisions, there are lots of decisions, including the choice of provider and whether, the choice of treatment, whether to comply with recommendations, and that's something, the decision to comply or not is hugely important to people. In order for a person to feel like they have autonomy and control over themselves, they need to be able to say, well, I'm not going to do that. And it's not something that should engender an intervention on the part of other people if someone is refusing care, if they still have the capacity to do that. And of course, other decisions to be made are, when to seek treatment and when to stop treatment. Now, generally speaking, I decide my own health care, you decide your own health care, and nobody should be getting between you and your doctor except your insurance company and the government, of course. And there are really two different issues here. There's this decision about what health care you're going to have, and then the other decision about who's going to pay for it. And a lot of decisions end up being made on the financial side of things. But anyway, mainly you get to decide what health care you're going to have with your doctor. If you become incapacitated, the next person that would do it would be a court-appointed guardian if you have one. The next person would be your health care representative, which would be the person that you have designated to make healthcare decisions for you. So really the healthcare representative is there to avoid the need for the court-appointed guardian. Okay, that's your point person on healthcare. If you don't have any of those priority people to make a decision for you, then you run over into the Indiana Healthcare Consent Statute, which allows certain relatives to make a healthcare decision for you if you cannot do it for yourself. And those people include the spouse, the parent, the sibling, the adult child, and the religious superior. And by that, they're talking about a nun in a convent, not your pastor. Your pastor does not have that type of authority. One of the huge problems with that is that there is no priority, so any of them can make a decision. And we all remember, I think the Terry Schiavo case, unless you're too young to remember it, really made an impression on everybody, because that was one of the situations where there was nothing in writing and two different groups of family disagreed about what health care Terry Schiavo should have. Her parents wanted to continue treatment, her husband wanted to stop it, and the courts had to weigh in. And unfortunately, in her case, it really became a very public drama. And that's not what people want. That's not what the Indiana Supreme Court wants. The Indiana Supreme Court has made it very clear that they want these decisions to be made by family members. And even in the case of Sue Ann Lawrence, who never had the capacity to make this decision for herself because of severe brain damage, the court was happy to have her family make that decision, and they chastised and actually disciplined the attorney who attempted to intervene in her case and prevent them from withdrawing life support from her. So in Indiana, drama and public airing of these issues is not favored. You know, people wonder, well, will I really need this? Will I ever become incapacitated? And you know, the odds are pretty good if you live long enough that there will come a time when a decision will have to be made. And it may just be in the last day of your life. You know, it may be sooner than that. 10% of people over 65, and that's probably an old number. I'm not sure if that's accurate or not, but a lot of people end up with dementia as they age. And over 85, you'll have a lot more people who have impairment in decision making, impairment in communication, even if their decision making is still intact. A lot of reasons to have somebody that can speak for you. Now, if you don't do anything now, there may be nobody to make decisions for you. You know, and some people count on their children and outliving them and taking care of those things. And often they're surprised, you know, to be the last one standing in the family. And so that's one side of the problem. The other is whether there are too many people making decisions. And the other problem is that your family members may not know what you want. They may not know if you haven't had the conversation. And there are lots of really cool online tools for instigating the conversation and, you know, sort of looking at the sorts of decisions that might have to be made. And so even if you appoint one person as your healthcare representative, it's really good to have that conversation with anybody who's going to be affected by your decision or the healthcare representative's decision to withhold or withdraw care or to continue care. So I'm here to tell you to put your wishes in writing. And there are lots of tools for that now. And we'll kind of go through them one by one. The living will, of course, is very limited in its scope. Okay? You decline life-prolonging procedures if a condition is terminal and death is imminent. And basically they look at, you know, the doctor has to indicate that they don't expect you to live 6 months. And that would be considered eligible for the living will to come into play. On the living will form, there's an option to make a decision about hydration and nutrition. You can consent to it, refuse it, or you can leave it up to your healthcare representative. But again, it does not apply to some of the things that really break my heart, which are people who are in a persistent vegetative state, or someone who is just completely incapacitated from a stroke. It's not going to be terminal. Those folks can live for a long time, and the living will is not necessarily going to apply. The other limitation is that it only covers life-prolonging procedures and hydration and nutrition. And there are lots of other decisions to be made along the way. The other side, or the flip side of the living will, is the life-prolonging procedures declaration. And I view this as the optimist's choice. You know, and I have run into people in the course of practicing law who think that medical science can fix anything eventually, and they are afraid that if you withdraw their hydration and nutrition, or if you don't do life-prolonging procedures on them, the day they die is the day that medical science will find a cure for what's killing them. And so this allows them to say they want everything done. So for the person who anticipates that they may become incapacitated from something that is not necessarily a terminal condition, there needs to be something else. And that's where the appointment of a healthcare representative comes in. And of course, this is a legal document. The state of Indiana has prescribed certain language that should be included in it. I recommend going to an attorney to have this done because you want to make sure that it's executed properly. You want to make sure that it complies with the statute. The big question is, who do you appoint as your healthcare representative? Okay? And you want somebody you can trust. And there are different reasons that you might not trust somebody. You might not trust somebody because they only have 100 minutes on their cell phone and you can never get a hold of them. You might not trust somebody because they view every day that you are in a nursing home as that much less that they're going to get an inheritance. You know, or you may trust somebody because they disagree with you about end-of-life choices, and their goal is going to be to keep you alive because they love you so much that they can't bear to see you go. So you want somebody you can trust. You want somebody who can be an advocate. And there's a difference between an advocate and a pain in the ass. You know, I mean, you want somebody who is effective at communicating, who isn't afraid to speak up, but who knows how to speak to people in authority without becoming hostile and aggressive. So, you know, there again, you know your family members. You want to pick the person who's got diplomacy, who's got a backbone, but who doesn't raise their voice at the drop of a hat, because that really breaks down communication. It causes a lot of trouble when you're trying to basically deal with the treatment team on what choices are going to be made. You want somebody who understands you and understands what you need, understands what is meaningful to you in your life, okay? Who will know at what point you would choose to discontinue care. So of course, somebody who is available is important. Now, within the scope of the healthcare representative, you do give authority to withhold healthcare, to consent to healthcare, and to withdraw healthcare, which in the past has been kind of a touchy thing. I mean, you know, sometimes in certain circumstances, families were unable to withdraw care. And with some providers, that may still be an issue, even though it shouldn't be. So having it in writing that that's what you want the person to be able to do is very helpful. The other thing that we do in our office with our healthcare representatives is offer an option to give specific instructions. And these are not necessarily mandatory, but they're written guidance to the person who's acting as the healthcare representative. And they can be enormously helpful if the healthcare representative is making a decision and other family members are second guessing and maybe threatening to get a guardianship or going to court. Because if you're deciding as a healthcare representative that you're not going to have CPR and you're not going to have artificial hydration and nutrition, and the healthcare representative says that's what the person wants, there isn't a court that is going to override that if the document is brought to the court's attention. A lot of my clients don't like to do the specific instructions. I find that kind of interesting. I guess maybe because I'm a control freak and a lawyer, you know. I mean, I can hardly sign a financial responsibility agreement anymore when I go for medical care because I read the fine print and I always cross things out. And so of course I want to have some detail in my end of life planning. You know, I did the same thing when I went to the hospital to have not my first child, but the second and third child, because I knew that if you didn't have doctor's orders that were signed, it was sort of hit or miss whether you got the sort of treatment that you wanted. And it's going to be the same way with this. If you don't specify what you want, well, maybe your family member will remember what you said, maybe they will do what you say, maybe not, you know, and there's nobody to sort of hold them to it because the document says that. So But anyway, the thing about about not giving instructions is it allows that healthcare representative to make the decisions. It gives them flexibility. So if you think your child can make better decisions than you can on these issues, that's a recommended course of action. It is easier, and I think the real barrier for people doing specific instructions is they have a hard time getting their minds around what possible scenarios could come up. And you can't possibly anticipate everything that's going to happen or every, set of circumstances. So, you're not going to address everything in your instructions, but you will give some clarity to the decision maker. In your instructions, you can address whether you want medical care to stop if certain conditions occur. And the classic, the ones that everybody knows about is the persistent vegetative state. Some people might indicate that they don't want a lot of medical intervention beyond comfort care when they can't recognize anybody, they can't communicate, they can't think, they're in severe pain. That's a rational reason to say enough. If requiring help with activities, if they can't breathe without a machine, if they can't eat without a feeding tube, if they're confined to a nursing home, they may want to say, okay, let's dial back the level of medical intervention at this point. It's totally a personal decision, and and everybody draws a line at a different place. And my favorite story about this is my boss, who says that he wants medical care to stop when he can no longer operate the remote control. And I totally understand that. One of the hardest things for me to see when I was an ombudsman was I walked into a nursing home at before lunchtime, and there were 10 people sitting around in the dining room, and the radio was blaring static. And I thought, if there was ever an example of people who don't have the autonomy to control their surroundings, that was it. And that, I'll tell you what, if somebody plays static for me, I'm going to come back and haunt them. But anyway, you can see how it can be very personal, how you want to make those decisions. Of course, the standard things that people see are, whether you want to have artificial hydration and nutrition, whether you want to be treated for reversible secondary conditions. And here what you're talking about is probably pneumonia more than anything else. Do you want aggressive antibiotic treatment for pneumonia when, in the olden days they would consider pneumonia to be the old person's friend because it's a door out. Some people don't feel that way. They feel like you can cure pneumonia and let's do it. But other people might view that as a positive thing. And the thing about it is these decisions, if you are capable of expressing an opinion about this, you can say, yes, I want treatment for pneumonia, or even nodding your head, yes. You can change your mind. You can say not yet as far as cutting off care as long as you're able to. So these sorts of guidelines are for when you no longer have the capacity to make these decisions or to communicate them. Resuscitation, chemotherapy, pain medication, home care. And home care is usually expressed as a preference. The other thing that I've had people decline is ECT, which is electroshock therapy. And some additional issues that are addressed in your instructions are the right to be left alone, and it's a constitutional right, to be left alone, to not have somebody touch you when you don't want to be touched, to not have treatment put on you when you don't want it. Some other things that you can decide through your documents are whether you want to donate organs or have an autopsy. There is a new document, well, not new, but relatively new document for saying how you want your funeral done. And I always tell people, as far as funeral arrangements go, the best way to control that is to pay for it ahead of time. Pay for it, organize it, but then you can also do a funeral declaration. And it's funny because there are families where there will be a fight over where the person is to be buried, especially if there is a second marriage and children from a first marriage. So you want to do the funeral declaration in that case if you want to be buried next to your current husband or your most recent husband, and the kids want you to be buried next to dad. I mean, that's just kind of an example of that. The other thing you can say in a healthcare rep documentation is whether you want the representative to be able to delegate authority. And that can be good if the representative is a traveler and they might want to leave another sibling in charge while they're gone. You can also say who you don't want. So you could say, my representative may delegate this authority to somebody if they're not going to be available, except that they may not delegate to somebody, so the black sheep of the family. Of course, I think I mentioned this before, that the writing is just the beginning. You have to discuss this with your family. You have to provide copies to the representative, to the doctor. You probably want to have a card in your wallet that says you have this, and where it is, so that if you are taken to the hospital under emergency circumstances, it might get found. Maybe you should have it tattooed. It's kind of hard because sometimes the best laid plans and nobody knows about it, and there's emergency care provided, and you end up on a ventilator or, that sort of thing, and it can happen that way. Without a hospital do not resuscitate orders, sometimes those orders are put right on the door so that emergency personnel coming in will see them, because it's that easy for it to get lost in the shuffle. The new thing, and I basically provided a copy of this to everybody, is the POST, the physician order for scope of treatment. And this is designed to be, to address some of the inadequacies of the living will. So, and also to give more weight to the choices made because it is signed by the patient and the physician. And it can be signed by a healthcare representative in place of the patient, but not one of the default representatives. So only if you've already given a written appointment of healthcare representative to somebody in the family, can that person take care of, now you know who I am. So for that person to sign the POST for you. And the POST addresses more than terminal conditions. The way that the test was described to me is sort of if the physician wouldn't be surprised if you died in the next year. So basically what they're talking about is people with chronic illness or frailty, people who do have a terminal condition are covered by this as well. But I think that including that group that has a chronic progressive illness can address things like Alzheimer's or people who are chronically frail because of severe osteoarthritis. You really don't want to have CPR done if your bones are very brittle. So that may be something that you talk to your physician and you get a POST for. And you can address CPR, antibiotics, hydration, nutrition, and medical interventions through the POST. Are there any questions about the healthcare aspect of planning?
Only one thing, and I don't know if you're out of town or in a different state, I've heard both things about they would honor anything that was done in this state, but other states, they may say, well, we don't, that kind of thing. So if you carry a copy of something with you, let your traveling companions know that you have a will or whatever.
Generally speaking, if the document was validly executed in the state where it was executed, which would be Indiana, other states should give it full faith and credit. Now, if you're somebody who bounces between here in Florida or here in Arizona, you might want to do the Florida and Arizona version of these documents just so that when you go to the hospital, the medical providers aren't scratching their head and wondering, what is this? Because people will, they'll be more comfortable honoring something that is familiar to them. But if you're just out on the road, no, I wouldn't, You know, you don't have to do one for every state you're going to pass
No,
through.
I just thought about
Yeah.
vacation, like what's a place for 2 or 3 weeks or.
Right,
something like that.
right. Yes.
Is there a legal distinction between the term withholding life-prolonging procedures and allowing natural death?
Well, I think that they can mean the same thing. I mean, if you're withholding life-prolonging procedures, basically you are allowing natural death.
Right.
So, and I guess the withholding is just an instrumentality of allowing natural death. It's just making it clear that that is one of the things that you can do. Because you could die naturally eventually, no matter what kind of treatment is done to you, but that allows for the process not to be dragged out
Right.
by the intervention of life-prolonging procedures.
Well, the reason I ask is because in our daily practice, we generally use the term allow natural death
Right.
as opposed to withholding, the life-prolonging procedures. But I didn't know that in the legal realm, if you're creating an advance directive, do you need to have that phraseology of withholding life-prolonging procedures?
I think you need to make it clear.
Okay.
I think it's really important to be clear about what you mean, and to be clear that that is what you're including in allowing natural death, even though allowing natural death sounds gentler and kinder.
That's why we use it.
Yeah.
Thank you.
An advance directive as far as do not resuscitate, can it be as specific as, well, if I'm having surgery and my heart stops, they could attempt to shock, but to crack open chest and that sort of thing.
I think you would have a hard time anticipating that. I think that every time you go into the hospital, they ask you if you have an advance directive. If it's going to be a really invasive additional procedure, like cracking open your chest, if they're smart, they're going to get consent from your healthcare representative. Yes.
In a hospital setting, if somebody's having surgery, they are supposed to be explained that a certain amount of time after that surgery, the DNR does not apply.
The what? Oh, the DNR does not apply?
Like 24
If
hours.
you die during the surgery, they have to do what they have to do.
Well, but if you tell them not to,
Yes.
Yes.
Because that's a surgical procedure, and
I am on. That may be practice, but I don't think that's the law.
I work on a med-surg floor, and we have had doctors actually explain to the patients, we know that you have a DNR, but you need to know, and your family needs to know, that that is not honored until 24 hours after.
That is not part of the law, though. And I'll tell you what, if somebody resuscitated me and I ended up with brain damage, I'd encourage my family to sue for battery, because you're doing something that I don't want. It's part of the whole autonomy thing. And maybe I wouldn't want to be having surgery either.
Well, and there are times that they say
Yeah.
to the patient, your situation is not, it's very poor choice to have surgery. I mean, they go through that, but I have actually heard them tell people, we do have to do whatever has to be done first.
They told me that when I had a colonoscopy.
Well, and that's a routine procedure, so it's like, yeah.
And we actually have them.
Under the post, you're right, under the post, like things that come up that need to be addressed right away are not necessarily covered by that. So you may fit under that, but,
Yeah, see, I don't know.
I think that as a patient, you may have a choice. You may just have to say no, because basically it's the doctor that's putting the condition on that, and I'm not sure why, but
There's some kind of a law that affects that too. I don't remember what it is. It is something.
Yeah, well, it's a very interesting question, and the next time I give this talk, I will have a better answer. Yes.
One thing too, she's a nurse on the unit. One thing I always hated to see was as far as regarding do not resuscitate. Sometimes, I don't know how come it was wrote that way, that the family or patient would say meds only, which means you go in and they're not breathing. Only thing you're going to do is do meds, and so I thought, what in the world? And the doctors would write it that way, for code status meds only. And you do that too. We do get that. Yes, yeah, and I don't think things are
But when
explained
it
enough.
involves surgery, there is a
Oh, yeah,
certain
surgery,
amount of
yeah.
time.
Because all the
spent,
regular
and it
units-
has to be, everything has to be.
But just on the regular units, when you ask all these questions, it's like, it's only, yeah.
It seems to me that if you gave written consent for them to not do everything,
And I don't know what that would say.
if you would be
That would
specific
make a
about it.
difference.
Here I am, I'm the person that crosses everything off of a consent form and rewrites it, so I would be doing that, but, and then I'm out and they're gonna probably do what my husband will let them do. Yeah. I don't know. I mean, I have heard stories of people having advance directives and not having them honored, which is why I'm hopeful that having it signed by a physician is gonna help getting them honored. Yes.
I don't know if I'm jumping the gun on what you might go into in a little bit. If a person appoints a POA, then is affected by dementia after they appointed it before, that person no longer wants to be a POA.
Right.
The family is just trying to just appoint a new POA.
No, that's,
And the actual, there's an attorney involved who's letting this woman
Sign.
with dementia sign.
well, there certainly
for
is a,
POA.
there is a continuum of incapacity. And so, somebody might have good mornings, they might understand the idea of giving their child the right to make decisions for them. They might, but yeah, you really need to be careful with that because
But here's my
It's-
problem is I've even called the doctor and the doctor's still kind of like, I don't know where I stand on it. It is honestly a good decision. Overall, it is a good decision.
right.
But I'm struggling with the fact that this woman really does not, in my opinion, does not understand.
Does not understand.
That
She should not be
she's
signed.
reappointing. But there's an attorney who's doing it,
Yeah.
and the doctor still is not decided yet whether he
And those are difficult
wants
situations.
to say she's competent or not.
Those are difficult situations because if everybody in the family agrees that this is a good thing, nobody's going to turn around and file a guardianship, which would be the way to challenge it. And so kind of by default, it's going to be in place and yeah. As a practical matter,
Well, that's kind of where I'm at, and it is just like,
it will
it
work.
really is what's best for her, so.
As a legal
but then
matter,
there's
it's not
that,
proper.
Like, education, where I've been taught, she really isn't capable of making this decision anymore, and I'm like, so do I just shove and crawl under the rock, or?
I'm sorry?
That kind of makes you wonder if it doesn't even go to court.
Well, it could, and actually, you don't actually have to go in and get a guardianship. You could go in and say to the judge, look, this is what happened. Okay, we had this power of attorney, they can't do it anymore. We would like the court can appoint somebody as part of a protective proceeding, short of a guardianship, where everybody comes in and agrees and makes someone power of attorney. And that would be the
Sounds like.
the proper way to handle this. The other thing would be to file a guardianship. And of course, it's really important to have somebody in place as a power of attorney, and to avoid just this situation, you want to name a first person and then you want to name an alternate. And if you're naming your peers who are all in their 80s, you probably want to name 3, because you don't know who's going to be standing to do it when you need it. The other thing is being a power of attorney, being a power of attorney is a hassle. Okay, it's not really something you want to do to somebody, except that you probably need to. So you want to thank them and support them and And if they start acting on your behalf, you want to be nice to them and not give them a hard time. Because it's a hassle with different family members and with people who are in maybe sort of medium dementia, deciding they don't want this person anymore. It can really bring a lot of heartache, but most of the time it works fairly well, though. And with the power of attorney, there are basically two different kinds. There's three. There's a short-term power of attorney. So when you do a real estate transaction, you'll sign a power of attorney for the title people to fix things if there have been any errors. If you go on vacation, you might sign a short-term power of attorney for somebody to do something for you while you're gone. There's the durable power of attorney, which you put in place now, and it survives incapacity and continues, when you're no longer able. And then there's the springing power of attorney, which comes into effect when your doctor certifies that you are no longer capable of making your own decisions. So for people who have control issues and they don't want somebody in their business too soon, the springing power of attorney allows them the option to appoint somebody but not give them any real authority until the doctor says so. Let's see.
Isn't there a power of attorney over financial and health?
Well, generally the power of attorney that we do is one document and includes health, and then we do a healthcare representative as well. So the two documents work together. Other people will do one for everything else, one for health, and the healthcare rep. That might make a certain amount of sense if there are specifics in the financial part that you don't want everybody looking at. And you can narrow what the attorney in fact can do for you. If you do a general power of attorney that allows them to do everything that's authorized by statute, well, they can clean out your checking account, they can sell your house, they can get a mortgage, they can invest in their own business with your money. So, you have to be careful about who you give this power to.
And so if you are still competent,
If you're still doing your own thing.
right, but then you've named them as power of attorney in the durable manner, they can come in and do that too?
Well, then you have you still have the authority to do everything for yourself, and they have authority to do things for you. And that can create some issues if people don't communicate well, if there are, family issues that.
So they come in and clean out your bank account and you're still capable of making all those decisions.
Well, you
hold
have
them accountable for that and take action on
absolutely,
that?
absolutely.
Even though you name them as POA?
Yeah, you have the right to request an accounting for everything they do using the power of attorney. And if they don't provide one in 45 days, you have the right to sue them and recover your attorney's fees. And actually, they could be criminally prosecuted for theft, conversion, because they're converting your property to their use without your. Well, that might be dicey because you've given them authority, but the authority is limited to acting in your interest as a fiduciary. So yeah, it's defalcation, one of my favorite words, which means that even if they try to bankrupt, if you sue them and you get a judgment and they try to go into bankruptcy, you can probably fight them on it. Yes?
With the springing power of attorney, you said the physician makes the decision. Is that usually just your own physician or requiring a second opinion as well?
Well, you could do it either way. You could. And, if you have trust issues, it might be worthwhile. Because, I have had families take a person to a doctor they've never seen before. They don't hear well.
Right.
They don't present well because they can't tell what's going on. They don't have their hearing aid with them. And they have a UTI and they're not with it that day, but most of the time they are. So, yeah, there's a lot of mischief that can go on with the power of attorney. And so the main thing is to really be cautious about who you appoint. And I will say that no power of attorney is better than a crook. You know, I did have clients one time who were pressured into appointing their child as their attorney in fact. And he did exactly what I suggested. He took the money, put it in his business, left the state, you know, and there wasn't any getting that back. So one of the things that we do in our office also is revoking powers of attorney for people. You know, that comes up. I mean, lots of times the role reversal really is hard on a relationship. And when the child is trying to tell the parent, this is the way it's going to be, the parent may rebel and say, okay, I don't want you anymore. And one of the things we try to do is get everybody to sit down first and see, well, what's the problem here? Because the power of attorney can be really useful, you know. And sometimes you can just kind of get people so that the child realizes that the parent still has the right to make their own decisions and doesn't try to tell them what to do. That they're there to help, to assist, to do things the parent isn't able to carry out themselves, but not to control who comes in and out of the house or who they spend time with, or, oh, and the best is the boyfriends, okay? They don't have the right to tell you can't have a boyfriend. And, you know, that happens. So yeah, so revocations come up, we do them. The main time it's really important to do a revocation is when somebody's raiding the bank, you know. Somebody's doing something really bad, and we have filed suit for people who couldn't, you know, who lost funds because of what their attorney in fact did. The accounting you can request once a year. I recommend that, as a matter of fact, that the attorney in fact give an accounting every year anyway, just because there's that potential that they could be required to account for 10 years of stuff that they've done, and they won't have it together. It's easier to do 1 year. And the most discouraging thing for me is when somebody comes to me and they've been asked to provide an accounting, and they come in with a sack of stuff with checks made out to cash. No. So yeah, I mean, it can be really a problem.
Are POAs ever required to be bonded like some guardians are?
You could require that. Because they're usually part of a family relationship, we usually don't require it. You know, but, you know, that might be a good resolution for somebody who's hesitant, is to see if well, and then of course the thing of it is if the child is shady, they're not going to get bonded. Yeah. I had somebody who was trying to become guardian over a sibling, and they could not get to be guardian in the state of Georgia because they had filed bankruptcy and couldn't get bonded. So some states are a lot stricter than others.
And I have a question regarding POAs, because we worked with a particular person, and her POA has a criminal history.
Well, she chose them, and you can choose whoever you want. You know, now there are certain circumstances where there's undue influence in getting somebody to grant that authority, and that would be something to be on the outlook for, because then you could maybe invalidate everything they've done because of the undue influence involved. It's just hard to prove, too, you know. That's why it's a preferred practice when doing a power of attorney for the attorney to speak with the principal person separate from the person who's going to serve as the attorney in fact. Because then you have a better chance of ascertaining that they understand it, that it's what they want, that they know the consequences if this person doesn't do what they should do. You know, but, you know, when you've got, you know, somebody in the room while you're talking about it, they're not going to express any reservations a lot of the time. So you might want to also keep an eye on that, because that is a better practice. And if you have attorneys who are coming in and the daughter is moving the mom's hand on the paper, I don't like that, and that's really not legit. And I'm not sure that there's a really good remedy, but I would complain to the disciplinary commission about it, because I think it's bad lawyer practice. And I don't say that lightly, because nobody wants to get that letter from the Indiana Disciplinary Commission. But I think it's really bad to have people who are incompetent signing documents. Of course you have to, if you don't have advance directives in place for your financials, one of the worst consequences I've seen is people who can't get on Medicaid because nobody has the authority to spend that last dollar in the bank account. The standard resource standard now is $2,000. You have 2001, and it sits there for several months. Every month that's sitting there, you're not eligible for Medicaid. So it's good to have the person who either is on the bank account, which is what I view as Polish estate planning, but you just put family members on the bank account as a way to avoid there being an estate and all of that. It's also very convenient that they can then go ahead and spend that money to get you under the $2,000 threshold. But that's an important consequence of not having somebody in place. One thing that you can do if the person can't sign a power of attorney anymore because they're incapacitated is to have the facility where they're living become the representative payee for Social Security benefits, if that's the only income. You can have a rep payee for most government benefit programs. Other things, you really need a power of attorney to go in there and ask for it. So like pensions, you'd have to just get a guardianship to get that under control. Let's see. And if there's nobody, then a guardianship becomes necessary. And of course, that's my least favorite thing, because when you get a guardian in there, they really do take over all the rights of the person. And the person does not have any rights to make their own decisions. Although, under Indiana law, a guardian is charged with promoting the autonomy of the protected person. And I see a lot of that not happening. And it may just need a discussion about their role. I mean, they're not there to be the boss of mom. They're there to make sure that mom is safe, that her finances are taken care of. They're not there to keep, sibling rivalry is the thing that comes into the play here. Is they're not there to keep the brother away. They're not there to keep the boyfriend away. They're there to be supportive. And I have seen guardians do all of those things, try to keep the other kids out. And that really violates the protected person's rights. But anyhow, anybody can file a guardianship over anybody. And so the big problem here is you don't get to choose who it is. It's whoever's the pushiest really is the one that gets to be the guardian. And generally speaking, the court has the discretion to carve out areas for the guardian to do and for the protected person to do. In the local experience, that just isn't happening unless the protected person has an advocate with an eye on promoting autonomy. And so that's one thing that we do. Our office will not establish guardianship over a senior. We do not do that. Our priorities under the Older Americans Act are to represent that person if they want to resist the guardianship, if they want to resist the person who's coming forward as guardian, or if there's a guardian in place and that guardian is treating them badly or not managing their funds properly or doing any, or there's somebody else that they think would be better because that person isn't available. And we don't do very many of these cases, but it's very satisfying to see that person get back their life and walk out of the nursing facility where they're being kept because that's where the guardian child wants them.
Question.
Yes.
Is there any recourse for a person that needs a guardian but doesn't have any family, or if they have family but they don't have the financial needs to become the guardian? How can that person be appointed a guardian?
Legal aid does guardianships in Vanderbilt County for low-income clients. And then if Guardianship Services of Southwestern Indiana provides volunteer guardians, or if the person has money, there are a number of professional organizations in town who will serve as a professional guardian for a fee. But you're talking about somebody who really doesn't have the money to hire a lawyer. So Legal Aid or Guardianship Services of Southwestern Indiana. And you can contact Guardianship Services through they're located in the probate court. You don't happen to have the phone number, do you? No, but
Don't they depend on volunteers?
they do depend on volunteers.
Don't have anybody.
Yeah, so there's a wait, but they are placing more people. They're getting more people trained and ready to go. So let's see. So anyway, you can actually avoid a guardianship by putting wishes in writing, and by doing the advance directives, it can provide peace of mind. Avoid the chaos that comes from not having a decision maker or having 10 decision makers. It can avoid conflict by sort of tamping down the kids that want to argue with what your representative is doing. And most importantly, it's your chance to decide what's going to happen, as opposed to waiting for someone else to decide for you. Any questions?
I've seen, I guess I don't understand this, where I've seen where there's person A and person B as power of attorney. And in that, they both have the same authority, right? So if they don't agree,
Right. Well, usually what it requires too is for both of them to come together on a decision, and that I think that's dysfunctional in a lot of situations, because it's like herding cats for one thing, to get people in the same place at the same time. But also, the reason people do that is they don't want to show favoritism because of, the siblings being jealous of each other. And when they're that way already, you don't want,
they're not gonna agree.
yeah, you don't want them making decisions, because they'll argue with each other about everything. So the good choice there would be to pick somebody else if you can. Yeah.
And is there a legal distinction between child A and child B as the powers of attorney, or child A or child B?
No, yes, there is. When you say and, that requires both of them.
It says you can put in or, can't you?
Well, if it's or, then it could be either one making the decision, and then it's like the first one on the scene, right?
That's what I was gonna say, who would be, just whoever.
Because
gets there
there's no
first.
priority.
Okay.
That's why it's better to name child A.
There, I was gonna say, don't they have 1, 2, and 3, this person's first, this one's second?
You can do it that way, yes. The other thing some people will do is they'll name one child over finances and the other over health. And that way there's, I don't know, I guess they feel like they're treating everybody more or less equally. Yeah.
I spend a lot of time in Iowa with my son and his family, so my attorney allowed me to have 2 powers of attorney, and one is power of attorney if I'm in Indiana, and the other is power of attorney when I'm in Iowa. And
That's a good idea.
I haven't used it, and the same thing for health.
Yeah. That's a really good idea. And you might want to have the one they use in Iowa executed according to Iowa law. But the laws aren't that different from state to state either. I mean,
My
in some
attorney
cases
didn't recommend that.
they did not.
No, he just gave you the same document
Yeah.
for both.
But that's a really good idea, where you make the person who's going to be most available the one in charge.
but if the one in Iowa doesn't agree with what the one in Indiana is
That's
making
possible
in
when it
Indiana,
comes
then
to
they
do
could,
not resuscitate.
like, come and, fight it out, right?
I don't know.
I mean, if you're in Indiana and the one in Iowa doesn't
Not like
agree
you
with
gotta
what's going on in Indiana, can they come?
They don't have any authority in Indiana. Their authority is when you're in Iowa.
Yes.
That's a good way to divide the authority. Is
That's what I was saying.
that's not a bad idea. I haven't had anybody do that, but yeah. Any other questions?
Do you have any business cards and this written down about your hours and stuff?
I think what I'm going to do is email this to the to the person who's organizing this, and it'll be in it'll be available online?
It will be available online. I think all of them, you're supposed to make all of them available online. Her speaking in her, she can do that. She can email that. You guys should be able to access it. That. If not, you can talk to the lady at the registration desk around, where we all register going down that far hallway. And there's an IT person they have set up there too to help with that.
Yeah.
They will help you, yes. They will tell you exactly what the website and how to get this. It's
Yeah.
really, it's
But that's not on that website right now. what
No,
you're
she'll have
saying
to
is
put
that
it
you're
on,
gonna
they'll be
send
able to
it there.
explain to you how that's done.